Oh, hi. Welcome. I'm Dr. Casual. Come on in, have a seat. Just finishing up this note, and I'll be right with you. And good. Welcome. I see we have you in for a head-to-toe exam today. Is that correct? Wonderful. And is there anything precipitating this exam, or is this just for a general checkup? General checkup, great. So, this exam is going to consist of doing a head-to-toe assessment, which means I will be looking at your scalp, face, eyes, ears, inside your mouth, in your nose, testing your reflexes, and doing a general full physical examination of you. Alright, so during this exam, I'm going to have to get very close. I'm also going to have to touch you during that exam, if that's okay. Wonderful, appreciate that. And do you have any aversion to latex or gloves? You do, okay. So we'll use sanitizer today, and we'll just use my hands. But aside from that, let me get some general information from you and go over your medical history, and then we'll get started, okay? Alright. So up front, let's see, pull up your file here. Okay, have your height and weight recorded, good. Still a healthy weight, we like to see that. Okay. Any changes to your medical history? Any recent surgeries in the last year? No, good. Okay. Any new medications? Okay, good. Any major issues you're facing right now? A little sleeplessness, okay. Do you think that's stress related? Ah, we all experience that from time to time, but we'll take a look. And let's see here. How's your diet been? Pretty healthy? Okay. And your weight indicates that, so good there. How about alcohol? Good. Keep that down. Any illicit drugs? Good. That's what I like to hear. Alright. Alright, other than that, anything you want to tell me? Any feelings of anxiety, depression, sadness, thoughts of self-harm, anything like that? No? Okay, good. You can tell me. I am your doctor. And while I might not be a psychiatrist, we can refer you to people with mental health professional experience to help with those intrusive thoughts and bad feelings. So, if you do, please tell me. We're here to help. Okay, good. We like to see happy patients. Okay. Alright, and aside from that, anything else? Okay. Well, just gonna grab my sanitizer here and sanitize my hands, and we will get started. At least this stuff smells pretty good and not just like alcohol. I like to keep our office feeling comfortable for folks. We don't want our patients feeling stressed at all. Okay, so the first thing we're going to do is look at that face of yours. I'm just going to have you look straight at me. Good. Lift up that chin. Good. Look at me. Okay. Just going to touch your face gently. Looking for any cuts, abrasions, bruises, scrapes, lumps, bumps. Any moles or freckles that look a little out of place. We don't want any of those little nasty buggers doing anything they shouldn't and turning into something we do not want on your skin. Okay, still for me. Lift up that chin. Let me look under that neck. Neck. Okay. Alright. Now what I'm going to do is look at your temples here, forehead, your T-zone right there. Just like that. Under your eyes, and we're going to do a little palpating like this. And then I'm just going to go press right under your eyes there. See if there's any kind of pain or sinus tension that's giving you any kind of problems or concern, okay? Okay. So, just look straight at me. I know those planes overhead today can be a little loud, but just look straight at me again, and we're just going to tap right on the forehead. You let me know if there's any pain whatsoever. Okay, good. And now we're going to press on your temples, just to make sure, same thing. Let me know if there's any pain. Press. Good. Press. Good. Press. Good. And now I'm going to press right up on your eyebrows here. So just press. Let's move on to the T-zone there. I'm just going to press all the way down, right along the edges. Press. Any pain? Alright. Same thing, right under the eyes, on the sinuses. Press. Any pain whatsoever? Wonderful. Alright, now I want to take a little closer look at your skin here. I saw a spot I didn't really like the look of too much, so I just want to take a look right over here on that. I want to make sure that it's not going to be an issue, but don't worry, we can always recommend you to a dermatologist. Take care of it. Well, it's a little concerning, but we'll send you down the hall to our friendly dog dermatologist down there, and they'll take a look for you. I'm sure it's nothing. Don't worry about it today. It's not going to be a problem. But now I'm going to look at that scalp hairs. I'm just going to run my fingers through your hair. I'm also going to be using this wooden stick to just move your hair side to side so I can get a better look, okay? So I'm going to have to get real close again. You just stay still for me, and I'm just going to look through your hair here. Just moving it around, side to side. Just looking through, making sure there's no bumps, lumps, contusions, bruises, hidden moles doing that thing we don't like to see, or just anything generally that shouldn't be there. Okay, good. Alright. Okay. Alrighty, let's see. That looks pretty good. No issues here. Scalp's a little dry. Maybe look into a clarifying shampoo. Can definitely help. Alrighty. Well, your scalp looks really good. Tad dry in one little spot, but as I said, clarifying shampoo should clear that all up. It's going to make a quick notes on your face and your scalp. You have to love electronic medical records. Keeps everything in one place for us, so we always know. Well, now that that's over, let's grab a couple of vitals from you. Just a basic temp, some blood pressure, and then we will get on to the rest of the examination, alright? So, got my thermometer here. Just open up, say, ah. Yeah, there you go. Good, good, good. Yep. 1 sec, and 98.6, right on the money. And lastly, I would like to take your blood pressure real quick. So I have my blood pressure cuff here. Just gonna wrap it around your arm and then use my stethoscope and take your blood pressure. So if you would be so kind to lend me your arm for a moment. And let's get this on. There we go. Yeah, I know, Velcro can be a little much. Alright. So just hold still for me. If I ever remember to put my stethoscope back on the right way. Okay. So I'm just going to pump this up and we're going to take your blood pressure, okay? So just hold still. Just hold still for me. We're almost done. Wonderful. Great. Put that away. And now we're going to bring back the stethoscope again. I'm going to take a listen to your heart and your lungs. So you can close your eyes if you'd like, and just hold very still for me while I listen to that heart of yours. Alright, here we go. Alright, now I'm going to listen to your lungs. Just follow my instructions and breathe as I say. So, take a deep breath in and down. Good. And again. And down. In. And down. And in. And down. One more time, in and out. Again, in and out. Good. And I'm just going to listen to your tummy down here real quick. Make sure those intestines sound A-okay and gurgling like we want them to be. One more spot. Just want to make sure that we're hearing everything that we should. Good. Absolutely fantastic. And so far, so good. Everything seems healthy, normal, and working properly. So from now, we are going to do a little more of an in-depth assessment of you. So going to look at those eyes of yours. So first thing we're going to do So real quick, I want you to look straight at me and just follow this light with your eyes. Just follow. Good. Just keep following the light. Good. Good job. Wonderful. Good. Good, good. And this shirt doesn't have a pocket, so I used to just but oh well. I'm going to grab my other light here, and I'm going to come real close to you, and I'm going to take a look in your eye. So just hold still for me. I'm just going to go up and open your eye and take a look inside. Okay, very good. Just looking at your ocular nerve here, just making sure everything looks good, good, good. All right, why don't you go ahead and look to the left for me. Good. And now to the right. And now up. And down. And to the left once more. Okay, good. You know, and cha-cha-cha and all that fun stuff. And the other eye here. So just look straight ahead for me. Good, 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 good. And to the left. Good. And now to the right. Good. And up, up, up. Good. And down, down, down. Good. And left one more. Good. Wonderful. All right. So now we are going to check your pupil dilation. And what I'm going to do is just cover one of your eyes and then swing the light in and out and see how that pupil dilates, okay? All right, so just look straight ahead of me. And we're going to cover one eye and we're going to swing it in and out. And in and out. In, out. In, out. In, out. In, out. Very good. And we're going to do the other eye. Same thing. And in, out. In, out. In, out. In, out. In, out. Wonderful. I would like to do another follow the light test with you. I'm going to cover one eye and have you just follow that light. Follow that light. Good. Good job. Let's keep following. Wonderful. Same thing on the other side. And here we go. Just follow. Good. Follow. Good. Doing wonderful. Great. How are your eyes feeling? You can go ahead and blink. Great. So now we're going to do a very simple eye chart here. Just need you to read the letters I point to, okay? Good. 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 Wonderful. Can you read this whole line for me? And how about this one? Good. This one. All the way down here. Good. Now, how about that one? That one. That one. That one. That one. Wonderful. Can you read this bottom line for me? Good. Great. So happy to see that your eyes are working. And right now, I can't see any issues, so that is great news. Because most health insurance is not too keen on optometry. Now, I would like to do a little color recognition with you. So just tell me the color that you see as it comes up in front of you, okay? All right, here we go. Gray. Good. Red. Good. Orange. Wonderful. Yellow. Good. Green. Blue. Purple. Great. And last one. White. Wonderful. So your color recognition is on point. But I do want to test you for some color blindness. It is something that is sneaky, can develop with age, and we want to make sure that you're still seeing everything as clear as possible. So we have our wonderful Ishihara plates here. We have our control plates. Can you see the number here? 8, very good. And how about that? 6, good. So that's our control. And now we're going to just hop on over here. Can you see that? 5, good. How about that one? 3, good. These here. Good. And this one. Good. See if we can stump you a little. How about that? And that. Got them both. Well, I don't think we're going to fool your eyes today. I'd say that they are in perfect working order, which is absolutely fantastic. So now that your eyes are good to go, and we know that, why don't we check out those ears? Have you had any issues with them lately? Any trouble hearing? Lower high registers of noise? Any weird looking earwax coming out or too much earwax? Okay, good. So I'm just going to grab my otoscope here, turn the light on, as you can see, and I'm going to go into each ear, and I'm going to take a look inside, alright? Alright, so just stay still for me, and we're going to come over here. We're going to look inside that ear of yours. And that looks nice and clean. That's what I like to see. Tympanic membrane is nice and pearly. No redness, abrasions, or excessive wax buildup. Beautiful, beautiful, beautiful. That might be one of the cleanest ears I've ever seen. Check out the other side here. Let me just take a look inside. Good, good, good. And it is immaculate over here as well. Nice. Tympanic membrane looks good. No occlusions, no cuts, no abrasion. Good. Wonderful. Well, probably not necessary with how clean those ears are. We'll do a couple hearing tests for you. So I want you to close those eyes for me. And I'm going to make a noise in each ear, and you let me know which ear you hear it in, okay? Close those eyes. Alright, here we go. And good. Good. That's right, both. Good. Good. Great. Alright. So you can open your eyes, blink a few times. Go ahead, blink, blink, blink. And we're going to do a very similar test, except this time I'm going to whisper a word in each ear, and you repeat it back to me, okay? Alright, so close those eyes again for me. Here we go. Good. Dreaming. Good. Immaculate. Good. Opulent. Good. Coconut. Wonderful. Alright, go ahead and open those eyes for me. I think those ears are in tip-top shape as well. Just gonna make a few notes here for you. Ears are looking good. Eyes are in perfect shape. So when was the last time you did actually go to an optometrist? It's been a few years. So while those eyes are looking fantastic, I would definitely schedule an optometry appointment. Gotta get those annual checkups just like this one. Alright. Just one more little notes here. Good. Wonderful, wonderful. Alright. Let's take a look inside that mouth of yours, as we are trying to be as comprehensive as possible, aren't we? So again, everybody's favorite tongue depressor, I just need you to open and say ah. Just gonna look at those teeth real quick. Good, keep that mouth open. Look at uvula looks good, teeth look pretty good. Just keep that mouth open, lift that tongue up for me. Up, lift that tongue up. Good. Good. You go to the dentist at least twice a year. Good. Well, that's looking great. Alright, I want to test a little of your mobility now. So, your head looks great. Neck is fine. Ears, eyes, everything's looking great. Let's test a little of those joints. So, you hold up your hands for me like this. Good. Can you go like this? Good. Can you do that? Good. Alright, can you roll your shoulders for me? Good. And one more time, roll them back. Good. And roll them forward. Good. Turn your head all the way to the right. Good. And then all the way to the left. Good. Good, good, good. Drop your chin. Good. Lean back. Good. Alright. Your joint's been feeling good. No stiffness, aches, pains, anything like that? Alright. I'm going to do a quick reflex test on you. Just a couple of quick tap, tap, taps. We're just going to do your wrist, elbows, knees. Super simple. Alright? Okay. Just give me that arm. 1, 2, 3. Beautiful. Other arm. 1, 2, 3. Great. Wrist. 1, 2, 3. Good. Other wrist. 1, 2, 3. Fantastic. Now we're going to go down to your knee. 1, 2, 3, and good. And the other knee. 1, 2, 3. Wonderful. So far, everything is looking fantastic. No major issues. I would like to do one more test on you, a sensation exam, where I'm going to be touching you with a multitude of objects. So what we're going to do is we're going to bring back one from earlier. My favorite little wooden stick here with the fluffy bit on the end. So I'm going to ask you to close those eyes for me. And I'm going to either touch you with the wooden end or the fluffy end. So you can say soft and firm, soft and firm, soft and firm, okay? Okay, so close those eyes for me. Good. And touch, firm, good. Touch, firm again. Touch, firm again. Touch, soft. Touch, firm, good. Touch, soft. soft touch, soft. You're doing great. Soft, good touch, soft touch, firm, wonderful touch, firm touch, firm touch, firm touch, soft. All right, go ahead and open those eyes. We're going to do a little more of that. Except this time we are going to do a dull object. Dull, 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 dull. And a sharp object, even though you can see it's not sharp at all. But it has a finer point than this. So I'm going to need you to close those eyes for me. And begin. Touch. Dull. Touch. Sharp. Touch. Dull. Touch. Sharp, yes. Touch. Dull. Touch. Sharp. Touch. Dull, yes. Touch. Sharp. Touch. Dull. Touch. Dull. Good. And to do one final sensation test, we are going to do softest and soft. So the cotton swab is soft and the fluffy brush is softest. Alright? So go ahead and close those eyes for me. And we are going to touch softest touch. Soft touch. Softest touch. Soft touch. Softness touch. Softness touch. Soft touch. Softness touch. Touch. Good. Touch. Good. Touch. Wonderful. Go ahead and open. How are you feeling? Relaxed, I hope. And wonderful news. There is not a thing wrong with you. And I will say, that concludes our exam today. So I want you to go home, take it easy the rest of the day, get plenty of rest, drink plenty of water, watch your favorite show, relax, and be happy. You're perfectly healthy. If you ever need us, you know where to find us. We'll see you soon. Bye-bye.